Bismillahirrahmanirrahim. Topic of our today's talk is types of research design on the basis of nature of investigation. Now we already talked about the different research designs and their subtypes based upon the number of contacts with the population, study population, how often a contact is being made, the study population. Then we talked about the reference period of type of research design in which different reference periods, retrospective, prospective, and retrospective prospective study designs were discussed. Today we will be talking about the research designs which are classified on the basis of nature of investigation. So on the basis of nature of investigation, the study design is mainly in quantitative research can be classified as experimental, non-experimental, and now the semi-experimental or quasi type of investigations. Experimental versus non-experimental. As the name clearly suggests, the experimental study is the type of study which involves some sort of interventions or experimentation or laboratory works, whereas a non-experimental study simply is a study which is of the more type of an observational study or interview type of study in which no contact or no experimental intervention or experiments are conducted. To broad it up, if a relationship is studied starting from the cause to establish the effects, it is classified as the experimental study. Like you have got an outcome and you want to establish the facts, the effects, the cause, and that in which you intervene you actually work on some phenomena to establish some effects of that phenomena. For example, if you've got some disease, you develop a disease in mice model, let's say, and then you let's say try out different after development of a disease, then you try out different therapeutic interventions, and then you establish whether those therapeutic interventions they have led to the progression of intense disease or the disappearance of the symptoms of the previous disease. So that type of study design in which you starting from the cause, you try to establish the effects is called as experimental study. You go for the experimental work. If a relationship is studied starting from the effects to trace the cause, it is classified as the non-experimental studies. For example, again, in these types of studies, you right from the start, you look out from certain aspects which might have developed that certain phenomena or disease, let's say, and you just look out for the data, available sources of information, and that information might conclude you towards some outcome, and that is the non-experimental study in which you collect the data, you review the data, you try to establish the linkage from the effects to the possible cause. That is the non-experimental study in which the experiments, the laboratory work is mostly not being done, you can say. Suppose you want to assess the effectiveness of a dengue awareness campaign or the usefulness of a drug AZT in treating people who are HIV positive. In both of these situations, there needs to be a cause and effect relationship. Now there are two types, experimental, non-experimental. What we can do is the first involve the researcher introducing the intervention, for example, AZT for treating HIV. That is assumed to be the cause of change. AZT might be changing the HIV positive to HIV negative. And you have to wait until it has produced that specific change. Then this is an experimental type of study. And the let's say AZT, let's say you want to initiate a dengue awareness campaign, what you will do is you will initiate a campaign, and possibly this dengue awareness campaign might cause a decrease in dengue over the course of the time. So it might be the cause, and you have to wait until that cause, that campaign has resulted in decrease number of dengue viral infections. The second type consists of research observing a phenomenon and attempting to establish what might have caused it. In this instance, the research starts from from the effect outcome and attempts to determine the causation, a non-experimental study, in which, let's say, the people, they might have got developed the HIV, let's say AIDS, and you possibly look into the, you you might observe the phenomena, you might try to establish what might have caused it from the data available to you or history available to you, or you might observe the patients and look into their traits, their possible attitude, which might be leading to the increased developing of the disease. Or for example, if a person, they've got this sudden outburst of anger or depression or anger, or uh, possibly they are showing signs of high blood pressure. What you can simply observe the persons, their attitude, whether they are consuming increased amount of salts into their meals, whether they are utilizing a diet which is leading to increased blood pressure, is utilizing more cholesterol, so let's say utilizing junk foods. This attitude, by the observation, you connect the phenomena, you come into the conclusion, the possible that a person who is showing the symptoms of high blood pressure might have been developing because of his habit of using, let's say, junk foods, eating junk foods, utilizing more salts, using, not caring about these sugar diets, and they are is utilizing it. So you draw your conclusion based upon the person's behavior, his diet, his attitude, his, let's say, uh, his his habit of not working out or not doing any exercises, not going out for a walk, possibly uh, being obese, and so all these factors, you are observing a person, and then you develop the study, the fact from the outcome you try to try as a researcher tries to attempts to determine the causation, and it is more of an observational type of study or non-intervention study that is called as experimental, non-experimental study. A semi or experimental or semi-experimental study has the properties of both experimental and non-experimental studies. That is, part of the study may be non-experimental, another part may be experimental. There is a combination of a experimental as well as a non-experimental study. Another type, different type of study design. There are so many different type of experimental design. For example, the most common experimental design. Actually, in the coming lectures, we might be covering different types of non-experimental design and even major experimental design as well. Over here, just a few notable, very important study designs we might be discussing. There are, please bear in your mind, there are so many different other types of experimental design based upon the studies and based upon different disciplines. They have different types of study designs. In biomedical sciences, the most common one there. Besides these, there are so many other. We will be covering them as well. After only experimental design, as the name suggests, it's a study design which looks into the facts of phenomena uh, after the development of an outcome. Before and after experimental design, it looks into the two aspects, two way it looks into the development of an outcome before the introduction of intervention and after the intervention is being introduced. The control group, your study design is a type of study design in which a control is included in the study. We talk about it. The comparative design simply compares, let's say, you look into the let's say you try to compare ELISA versus PCR for the diagnosis of, let's say, coronavirus. This comparative study design is similarly, you can compare ICT devices versus ELISA for the detection of certain disease. You can compare so many other techniques. You comparative study, you compare different two phenomena. Placebo design or placebo effects are also studied. We'll talk about it in this lecture. The control group design of MS1 is utilize the control group where a researcher selects two populations. One is a control group population, another one is experimental group. The experimental group either receives or is exposed to the intervention, whereas the control group is not. Firstly, the before observations are made on both the groups where intervention is not introduced. Initial, the different parameters they are assessed. Let's say if you're working on human subjects, you take the blood samples, you look out for their BMI, you take their blood pressure, any other body test, possible body tests that are related to your work. You did those before observations or before interventions. You collect the data, then experimental group is exposed to the intervention, and when it is assumed that intervention has an impact, and after observation is made on both the group, whereas the control group is not going to be exposed to that intervention, and after the outcome or impact, another observation is made on the group, and you draw your conclusion. Any difference in the before and after observation between the two groups regarding the dependent variable is attributed to the intervention. For example, therapeutic potential of properdin on meningococcal disease in a mice model. In this type of experiments, what we actually do is we develop a mice model of infection, for example, meningococcal disease. We take a group of mice, let's say 50 group of mice. We inject them with the Neisseria meningitidis or meningococci, and the disease is led to develop. Whereas we have got another group or a control group in which again we introduce the disease. We give them the same amount of colony forming units or CFUs per ml to develop the same amount of meningococcal disease. 50 group with the disease, another 50 group with the disease. Now we have got, let's say, some therapeutic intervention, let's say this compound, like over here we have got properdin. It is a complement protein, and then one group is then injected with certain amount of properdin, and the other group or the control group is just injected with phosphate buffered saline or saline, and then we are going to we are going to collect data, blood samples and other bodily samples, let's say, and we are going to develop or ascertain whether this introduction of intervention, let's say properdin, is resulting in the decreased mortality rate, let's say, or not, whether it has got some beneficial effects on meningococcal disease or not. So one group is going to get the medical intervention, whereas another group is going to receive his control group is going to receive a normal saline, or his group is not going to receive that intervention. So we are going to compare them, and this is the control group design. Placebo effect. It's the patient believes that he is receiving a treatment and can play an important role in his recovery from illness even if that treatment is ineffective. This psychological effect is called the placebo effect. Patient assumes that he is receiving some sort of treatment, but actually he is not. So he might be, let's say you are just giving a person like just the capsule only without the chemical inside it, just the capsule. He is 3 times taking it with water, and he might be thinking that he's utilizing the capsule, but it is just an empty capsule without it. This is sort of, and he might be recovering from the illness as well. So this type of effect is called as a placebo effect. A placebo design attempts to determine the extent of such type of effects. It involves 2 or 3 groups depending on whether or not the researcher wants to have a control group. That depends. If the researcher decides to have a control group, the first group, it receives the treatment, the second group receives the placebo treatment, and third group, it receives nothing. And the decision as to which group will be treatment, the placebo or the control, can be made through randomization. That depends. You can randomly select these 3 types of groups. For example, empty capsule versus pain relieving capsule. For example, a person for a headache, let's say, he might be receiving a drug, whereas another person, he might be getting a toffee for that effect. But both of the persons, they show sign of improvement. They say okay, a person who is receiving the medicine is saying my headache is gone, and the person who is receiving the tablet, the let's say some other thing like confectionery or any other thing, an empty capsule, or and he is also saying that my headache has gone. He is assuming he doesn't know that it's just a placebo effect. There are so many other placebo examples of placebo effects as well, like For body pain, you just use these warm water bottles or hot water bottles, or warm pillows for the head neck pain. So those are also considered as the placebo effect in the medical study, biology, medical research as well. Thank you so much for listening to my talk.